In terms of the 3 shifts in the 10-year health plan, the one that I'm most interested in is the one which is about from sickness to prevention. And one of the ways that we can do that is by preventing harm. I've worked with a lot of patients who've been harmed through healthcare itself. And one of the most important things we can do is to listen to patients at all stages, the way that we design healthcare, when we deliver healthcare, and particularly after something has gone wrong. If we can do that in a really consistent and a really compassionate way, I believe that we can help to avoid harm to patients in the first place.
I think the 10-year plan doesn't major enough for me on the workforce challenges. You can strategize as much as you want. If you don't have the right staff to support you to implement that strategy, then actually it's just going to be a document on a shelf. So I think majoring a little bit more on the how we're going to deliver the strategy would be really helpful, very much taking into account what our staff need in terms of supporting them to deliver the strategy, because if not, it would just be another document in a few years' time.
It's all about the data and how do we use data to drive quality improvement. One of the key issues that we discussed about how do we triangulate the data from patient experience, patient safety, and some quality audit to tell a story and be able to drive quality improvement. It's all about using AI and technology that could be able to assist clinicians to be able to print them up, and we can make sure that we deliver a targeted quality improvement and be able to get a better outcome for the patient and for the staff as well. I think there's always an opportunity for AI and digital in terms of the delivery of the plan, but I don't think that's only the solution. There's a lot of factors to deliver the plan that we have, but there's always an avenue that can help with using the technology and the AI going forward. Everybody wants to do good. Everybody wants to contribute for the betterment of the care of the NHS. It's just so many voices, but I think by the end of the day, we're here to make it better for our staff and for our patients.
It was a fantastic session with the group. We talked very much in the IDG about the big shift from hospital and acute care into community care, something that's really important to us because both on our kind of risk and patient safety side, but also in terms of the work that we do on the workforce solutions side, very much looking at how we support all different areas with their workforce challenges. We very much talked about that shift and really focused on what people thought were the biggest risks in terms of patient safety itself, but also management of patient safety, and it was a really interesting discussion with lots of different views.
Our IDG was about how digital can improve escalation and response. We just had the opportunity to talk to a bunch of leading stakeholders about the challenges that they're facing in this area and how they're thinking about addressing those. People are concerned up front about the cost of new technology before diving into that, so that's an overriding concern that we're seeing. Getting business cases through is something that people are very concerned about, but the collaborative approaches that are being used in this area, I think, can really help.
I spoke about being brave in your leadership and empowerment and empowering our staff. So around their well-being, how when we empower our teams, we get the best out of them. If you get patient safety right and patient quality of care in their experience, finances and performance follows. You can't have one without the other. I think that we are really good at using reasons for why we can't develop something or why we can't fix something. But actually, if we look at everything as a whole, if we look at how much waste we're doing, we could easily put money back into the things that really matter. But we have to stop using everything we can as excuses for poor patient care, because actually you don't need money to give good patient care. You just need somebody who cares, that talks, that listens, and can provide those skills.